Okay, guys, welcome back to another episode of Parked with Jorge, because here we are, parked, posted up. Anyways, today what I'm going to be talking to you about is jockage. Now, what is jockage? Jockage is a fungi. It's a type of fungi that thrives in moist environments and is communicable. And what that means is it can be transferred from person to person or object to person. And the reason I'm talking to you about this today is because there's currently an epidemic going on in our country in which there's many college athletes that are contracting jockage, and we're going to be speaking to an NCAA scientist later on in the show, so she can talk about that. And we will also be speaking to a victim of jockage. Now I'm gonna explain more what jockage is before we transfer to them. So it is the symptoms of jockage include redness, a burning sensation on your skin, flaking skin, rashes. Those are the most common symptoms of jockage. Now, currently, 20% of the world has either contracted or will contract, or is at risk of contracting jockage. There are no death statistics to compare to because you cannot die from jockage. It can only weaken your immune system and pretty much annoy you. Some of the risk factors for contracting jockage include being overweight because you have more skin flaps, being in a moist environment because that's where the fungi thrives, sweating profusely, wearing tight clothes, being a male because men get it more often than women, being a teenager as well, having diabetes, and having a weak immune system. Those are the most common factors of contracting jockage. Now I'm gonna pass it over to the NCAA scientist Valentina Jimenez, and she will go more in depth into that.
Thank you, Jorge. Jockage disease is found in developed countries more often than it is found in developing countries. This is because in countries like the United States, a well-developed country, there are more obese people. These people face problems with their skin-on-skin contact, skin-on-close contact, which leads to irritation, and this moisture between the skin is in favor of the jockage disease. The two main age groups affected by jockage disease the most are 14 through 18-year-olds and 60-year-olds and older. The transmission of jockage disease is fairly easy. It can be done through direct contact with someone who's sick or with indirect contact, meaning you touch their clothes, you touch their stuff, you could get jockage disease. To prevent yourself from getting jockage, wash your hands with water and soap and make sure you dry your hands thoroughly. You do not want to leave any moisture behind because that is in favor of jockage disease. What you also don't want to do is stay in your gym clothes after you work out. After you work out, change, wear something different. Don't stay in your sweaty clothes because, like I said, the moisture in your skin is in favor of jockage disease and you will get jockage disease. However, if you are one of the unfortunate people who fails to do this and does get jockage disease like many of you have right now, there are some at-home remedies that you can do. You can take over-the-counter medications such as antifungal creams, powders, or sprays, apply these onto the affected area, or you could just wash the area with soap and water like I said and make sure you dry them. If in 2 weeks these over-the-counter remedies and at-home remedies do not work, I advise you to see a doctor. They will prescribe you with either 2 types of medication, topical or oral. An example of a topical medication would be iconazole, and an oral medication that you may be prescribed is itraconazole. Thank you for listening. I hope my information was useful. And now we're going to be seeing what a first-hand victim of this jockage disease has to say. Now on to Angela Pava.
Hello everyone, my name is Angela Pava and I am a former athlete as well as a victim of jockage. I am here today to spread awareness of the disease in order to help you not face my daily struggles. It has been proven that men are more susceptible to obtaining jockage than women solely because of anatomy. Men naturally have a skin fold of their groin, which leads them to have a higher probability of getting that skin irritated or infected. As obese rates in the United States has increased, the probability of people, particularly men, getting this disease has tremendously increased. With obese or overweight people, their skin tends to fold over, which causes there to be much heat and moisture. This is ideal for jockage to form. Some methods that are recommended for the prevention of this disease is to not share personal things, wear clean clothes, and keep your groin area dry. By doing these things, you are minimizing the possibility of you obtaining jockage. On behalf of the NCAA, I would like to come forth and claim that we are doing our best to obtain fundraising for more research on jockage and ways to prevent it. My organization's involvement in the attempt to reduce the rates of this disease is that we are going to enforce stricter rules in the cleanliness of locker rooms and the weight rooms. By doing this, we will greatly minimize the fungus that remains on things such as exercise equipment in order to diminish jockage and all of its harmful effects. Our approach is appropriate and will work because jockage mainly forms and grows from sweat and moisture. By enforcing the cleanliness of gyms, it is sure to reduce the rates of this disease as well as its spreading. Thank you for listening. Now back to Jorge.
Okay, guys, that about wraps it up. That's the Jorge Show. I hope you learned something about jockage, and I hope you can become more aware of what it is, the fungal disease that it is, and hopefully you don't get it. Leave a comment down below, like and subscribe, and peace.